All right, let's get right into it. You know, we usually think of pain as our body's alarm system, right? It's loud, it's obnoxious, and it tells you something is wrong. But what happens when a really serious problem doesn't make a sound? Today, we're going to talk about some of the hidden dangers in our gastrointestinal system, the kinds of issues that can brew in total silence until things get very, very real. I mean, just think about that for a second. It's a pretty scary thought. It's kind of like having a smoke detector in your house with no batteries. You think everything is fine, but it's not. And that's exactly what can happen with some of these GI conditions. You're feeling okay one minute, and the next you're in a full-blown emergency. So how is that even possible? Okay, so to figure this out, let's start with a real-world medical mystery. Picture this. An 80-year-old person, probably taking ibuprofen for some everyday aches and pains. They show up at the hospital feeling super weak, they look pale, but when the doctor asks, where does it hurt? They say nowhere. They feel fine. And yet, the diagnosis comes back. They have major internal bleeding. This case is the key to unlocking everything we're about to cover. So, first things first, we've got to identify the culprit. What on earth could cause something so dramatic but so quiet? Let's put on our detective hats and look at the most likely suspect. For our patient, the problem is most likely a bleeding peptic ulcer. The easiest way to think about this is like an open sore, a little wound, but it's on the inside, specifically in the delicate lining of the stomach or the very first part of your small intestine. Now, if one of those sores gets deep enough to hit a blood vessel, well, that's when you get the kind of serious bleed we're talking about. Now, here's where things get really interesting, and it starts to explain the silent part of our mystery. See, not all ulcers act the same. If you have an ulcer in your stomach, a gastric ulcer, it usually screams at you right after you eat. But if the ulcer is in your duodenum, just past the stomach, food can actually make it feel better. The pain might just be a dull, gnawing ache that shows up in the middle of the night. It's so easy to miss that, or just brush it off as something else. Okay, so we know what happened, a bleeding ulcer. But the bigger, more important question is why? Why did our patient's body let this happen? What went wrong with their natural defenses? Remember that one little detail from the beginning? The ibuprofen? Yeah, it's one of the most common pain relievers on the planet. But for some people, especially if they're taking it all the time, it can be a real wolf in sheep's clothing. To get why, we need a quick biology lesson. We have to meet two super important enzymes in our bodies. They're called COX-1 and COX-2. And these two are at the center of a very delicate balancing act that's happening inside you right now. So check this out. They have totally different jobs. You can think of COX-2 as the instigator, or the body's alarm system. When you get injured, it's the one that creates pain and inflammation to yell, hey, something's wrong over here. But COX-1 is the protector. It works 24/7 as a bodyguard for your stomach lining, making sure it produces a nice, thick layer of mucus to shield itself from its own powerful acid. And here is the absolute crucial point. Painkillers like ibuprofen and aspirin are non-selective. That means they don't pick and choose. They shut down COX-2, which is great, your swollen angle feels better, but they also shut down COX-1. In other words, you just fired your stomach's bodyguard. Without that protection, stomach acid can start doing some serious damage to the lining, and that's how you get an ulcer. So, we've pretty much cracked the case of the silent ulcer. But you know what? That's not the only GI issue that can fly under the radar. Let's widen our view a bit and talk about another incredibly common condition that can be anything from a tiny bother to a serious threat, often in disguise. Let's talk about GERD. You probably just know it as acid reflux or heartburn. And really, it all comes down to a simple plumbing problem. There's a little muscular gate between your esophagus and your stomach. In GERD, that gate is, well, it's faulty. It doesn't slam shut the way it's supposed to, which lets all that corrosive stomach acid splash back up where it really doesn't belong. Now, these are the signs you probably already know. That classic burning feeling in your chest after a big dinner, that nasty sour taste in the back of your throat. These are the typical textbook symptoms of GERD. But that's only half the story. And this is where it gets tricky, because GERD is a master of disguise. It can cause chest pain so bad that people end up in the ER thinking they're having a heart attack. It can give you a chronic cough that just won't go away or make your voice hoarse. You might think you have allergies or a cold, but really, it's GERD in a clever costume. And just ignoring these symptoms, whether they're the classic ones or the weird ones, is a really bad idea.
That constant acid bath is basically a low-grade chemical burn on your esophagus. Over time, that leads to inflammation, which can cause scarring that narrows the pipe, making it hard to swallow. It can even lead to bleeding, and in the long run, it can cause the cells to change into a precancerous condition. So, you might be asking, how do we stop this? How do we fight back? Well, we've got some powerful weapons in our arsenal, but using them is a real balancing act.
For really bad reflux and ulcers, the go-to treatment is a group of drugs called proton pump inhibitors, or PPIs for short. And these things are workhorses. They are incredibly good at what they do because they go straight to the source and just switch off the little pumps in your stomach that churn out acid. But, and this is a big but, there's a trade-off. Because PPIs are so good at getting rid of the symptoms, they can actually hide the warning signs of something much more serious, like stomach cancer. A person might feel totally better and think the problem is solved, when really the PPI is just masking a deeper issue. That's exactly why you should never be on these long-term without a doctor's supervision.
Okay, this all brings us to what I think is the most critical part of this whole conversation. If pain isn't always the reliable alarm we think it is, then what are the absolute non-negotiable red flags that your body can send? These are the ones you cannot ignore. If your stool looks black and tarry, that can be a sign of digested blood. If you're losing weight and you're not even trying to, that is never normal. And that feeling of food getting stuck in your chest, that is a huge red flag. Any of these symptoms means you need to see a doctor, period. And this quote from the source material just perfectly sums up everything we've been talking about. So many people feel completely fine, right up until the moment a major complication happens. Feeling good doesn't always mean you are good. So really, what this all comes down to is awareness. We've just learned how to listen for some of the body's quietest, but most important alarm bells. The real question is, now that you've heard them, are you prepared to actually listen?